We are going now to start chapter 12. And as I told you in the morning session that we have this chapter talking about the pacemaker. And for summary or give you like information about what we mean by pacemaker, we learned together that pacemaker naturally is the SA node. So if the SA node is damaged, so the AV node will take the job, and if both of them are not working properly, it will be like the Purkinje fibers. And in this situation, of course, as you learned, that the heart rate is insufficient. So it will be like 20 to 40, which is not good situation. And the contraction of the ventricle will not be effective to push the blood. Let us go by this chapter to know that what is the points, or when we are looking for a pacemaker to be inserted into the patient. And this is very important chapter. So the artificial pacemaker, when the electrical conductive system fails to function sufficiently, like I told you before, and it will provide us with what we call pacemaker spike. So this is very important. And what is the spike? It is the wave produced on EKG by artificial pacemaker. So please save this definition. It is going to be questioned in the exam. Then what we need to know about the artificial pacemaker, that this artificial pacemaker will create or initiate electrical impulse in a specific location in the myocardial tissue. And what we mean by specific location, we have to know that we are focusing on the right side of the heart. What we mean by right side of the heart, Irene, we mean the right atrium and the right ventricle. So we will get two varieties, or actually three types of pacemaker. One going to be to the right atrium, another one going to the right ventricle, or it can be like in both at the same time. So we have many information regarding the pacemaker. Where we implant, it is implanted outside the body, under the upper left chest, under upper left chest. This is the most common place where we can implant the artificial pacemaker. Save it. Then we have the artificial pacemaker of two types. Transcutaneous, trans means through, cutaneous means skin. So transcutaneous pacing, it is commonly said as external cardiac pacing, consists of two large electrode pads like we are using in AED. If you had already the course of CPR, you are going to be familiar about this AED technique. So this is the temporary one. We are not using this as a permanent. So we have like anterior and posterior electrodes are going to be placed in front and back of the heart. And this temporary pacing is what we call that the cardiac muscle will go to be depolarized in a normal fashion. Will works normally. When we give electricity to the myocardium, it will be going to be very good. Unlike the manual defibrillation, the 3 leads or 4 leads monitor cable electrodes must be placed as well as pace pads in order to have the pacing work. Take care of this. What is the difference? And transcutaneous pacemaker, the patient should be like in supine position. Supine position means the patient has to be on his back, and we provide oxygen, and we provide intravenous, and EKG monitoring in place. Symptomatic bradycardia. Take care of this. Symptomatic bradycardia. Maybe we have bradycardia, but without symptoms, no problem. But if there is a problem, symptomatic bradycardia must be confirmed prior to implementing transcutaneous pacemaker procedure. So we have to be sure that actually the patient has symptomatic bradycardia before we start. Then the transcutaneous pacing are going to be set to work like normal one. So it will be like adjusted to, but like between 60 up to 80 beats per minute. And the initial voltage, this is very common question. Pay attention, Rihanna. This is adjusted as 0 milliampere. 0. Why? Because we don't know the threshold, if you remember what we mean by the word threshold before. So I don't know what is the threshold of this patient. So what should I do? I adjust the machine to be like 0. Then I'm starting to increase the volume bit by bit till I get what we call capture. What we mean by capture? It means that I get response. What is the response? Contraction. So Lewis will going to place the electrodes, will place the machine and start to increase the intensity of electricity bit by bit till you get a response. So this is what we call, like when we use most of the time, like we are having like speakers. So we don't keep the speakers like in high volume. We make it like very, very minimal. Then we start bit by bit till we get a reasonable sound. Here, we increase the electricity bit by bit till I get response. And the name of response is called capture. And capture will be wave, okay? The second type of pacing is transvenous. Transvenous means through a vein. And it will have like wire, and this wire is going through the skin, thread into the large vein. And what is the largest vein, you know? Superior vena cava, to the right side of the heart. Take care of this. Then the transvenous, controlled by external power source to stimulate atrium and travel through the electrical conduction system, which is already present within our heart. The pacemaker are preset or programmed to function in two ways. Either fixed rate, this means what? I will go to adjust that the rate should be like 75. It's okay, so it will deliver electrical impulse at a constant selected rate. So all the contraction will be transmitted to the heart in selected manner, which is 75 beats per minute. So I am already planned this one. Another one, which is demand. What we mean by demand? Demand means if the heart rate drop, like for example, Irene needs her patient to be adjusted at 75 beats per minute. So she has this option and will say that if the heart rate drop below 65, the machine or the pacemaker has to start working. Okay, so this is very important. So we have asynchronous and we have synchronous. We surgically implant the generator, which produces electricity through the battery, and lead wire going to be introduced into the heart through the central vein. Where the central vein? The question, Corin, where the central vein in the neck? Okay, so big veins going to the superior vena cava, going to right side of the heart. The second one, which is the permanent pacemaker. So we have to implant it, and we mentioned where the site of implantation. And it will give all the time working, but it is very important that we have to worry about, because it is working by a battery. So if the battery is like failed, so the machine will not work, so the heart will not work. So this is very critical points. You have to pay attention for it. So we mentioned that we have three types: the atrial pacemaker, and this is what we call single chamber pacemaker. In the right atrium only, the wire will go into the right atrium only. So this is single chamber. Or ventricular, which is also single chamber, right ventricle. Or dual, it will be in the atrium and ventricle, and we call dual chamber pacemaker. Clear? So the wire going to be in one chamber, can be right atrium, can be right ventricle, or we place two wire, one in the right atrium and one in the right ventricle. Then the impulse will start to stimulate the atria first, then produce another impulse for the right ventricle. So new generation is like demand, have very important technology, and this technology is like, it has a special character, like the implanted cardioverter defibrillator. And implanted stands for I, or I stands for implanted, and C is for cardioverter, D for defibrillator, to treat tachyarrhythmias, like we mentioned, if we have ventricular tachycardia or fibrillation. What are the indication of any pacemaker? This is question in the exam. Bradycardia, like I told you, when we start or before we start, we have to be sure that the patient has symptomatic bradycardia. The second indication, complete heart block, and second degree type 2, and sick sinus syndrome if the SA node is not working properly due to any disease like atherosclerosis or degenerative disease can affect the SA node. Like we learned together that we have this wonderful slides, and this wonderful slide is summary for what we mentioned earlier. Let us go by practice, and this practice will realize what we mean by this pacemaker. So please, if you would like to share with me, open your mic. Okay. So let me help you. So far, you don't need to share. Be familiar about the following. This is T wave from previous contraction. This is P wave. This is QRS. Okay. So what we notice here that we have a contraction happen after the spike. So where the spike? Where the spike? You see, this is the spike followed by P wave. Another spike followed by QRS. So this means what? I have wire in the atrium. I have wire in the ventricle. After stimulation or impulse, it will make capture, and this capture will start here and give me P wave. And we have another spike here followed by QRS. This is very easy, like we had in morning lecture, that we had one similar to this, that we can go and check for it again. Okay.
So would that be like a AV sequential double chamber?
Yes.
Because it's got two spikes in it?
Yes, correct. What are the problems? As I told you, that the problems is related to source of electricity. Runaway pacemaker. What we mean, of course, number one is battery failure. If the battery, like any device working with battery, if the battery is out of service, will not be like the device will not be working. Okay. And a runaway pacemaker, this is very rare to happen, which is like rapid rate of electrical impulse discharge result. So it is giving us sensation like tachycardia, which is not preferred. So this is very rare to happen. But another common or the most common problem, and this is question in the exam, it is failure of capture. And this failure of capture means what? The electricity is below the threshold. If you remember what we mentioned in the very early lectures, that we have what we call threshold. So if the intensity of stimulus is below the threshold, so there is no contraction. So no contraction is like translated to be failure of capture. So what is failure of capture? I will find the spike, Zahra, and the spike is not followed by P or QRS. So this is failure of capture. So how they diagnose? They do EKG, and they find that there is a spike, but this spike is not followed by any wave. So we call this is failure to capture. Another one, which is failure of sensation, that I adjusted the machine like Lewis need the patient to be like at 75 beats per minute, and he find that the heart rate is dropped to 60 and the machine is not responding. It should work, Aaron, okay? But actually it is not working. So it is not having, like the thermostat of your AC is not aware about that the temperature is getting high. So it has to be working. Now also the pacemaker is not having the sensation that the heart rate is done or heart rate is like low. So it has to be working. Actually, this is in case of only demand pacemaker, but the preset or asynchronous, it will work by itself, not a need to get the sensation if the heart rate is dropped. Pacemaker failure, of course, produce life-threatening event. Why? The heart is like not working. And so far the heart is not working. So as if the patient has cardiac attack, And this is very important when we find some people, they are like in lose consciousness or something like that, and you notice something implant under the skin, so they have pacemaker and this pacemaker is not working, and you have to be like emergency situation. As you see here, when you encounter an unconscious patient, check for small palpable mass underneath the skin in the upper chest. This presence indicates the pacemaker in place. And this is the reason. So when we carry this patient in emergency room, they have to replace the battery to make the pacemaker start again working. Here, we are going to look for this strip for chapter review, as I told you, and I will make it easy for you. Of course, the heart rate here, let us count the heart rate. Who can count the heart rate?
40 beats per minute.
Correct answer. 1, 2, 3, 4. Very good. What about this?
Is that where the pacemaker initiates the atrial contraction?
I can't hear anyone. Say it again, please. What this?
Spike.
Spike, correct.
Yeah.
This is the spike. And the spike followed by what?
A P wave.
So spike followed by P wave. So what you think this pacemaker located where?
In the atrium?
Right atrium. Very good. What about this wave?
It's QRS.
Yeah.
Very good. Correct. QRS. What is the criteria of this QRS? This is what? What
Wide.
type of wide? Very good. Very good. So wide QRS. And if you look here, this is the P wave and this is the QRS. P wave, QRS, P wave, QRS, P wave, QRS. What do you think? This is what type of, do we have relation between P and Q? No. So
Yes.
this patient is what? Like we mentioned before, it is third degree, no relation. In Haja, we mentioned no relation means a third degree heart block. This is why we inserted the pacemaker, and this pacemaker is working to stimulate the atrium, followed by ventricular character of the QRS.
How please, you mentioned it's not a relation between P and QRS.
Okay, we mentioned that for any heart block, either we look for the PR interval is prolonged and fixed. Here
Yeah.
it is not, it is prolonged but not fixed.
Yeah.
Of course, prolonged and progressive, no, it is not prolonged and progressive. It is
Yep.
coming here, like this getting
More
bigger, this is getting small again, so it is not getting progressive. Number three, if we have like many P's followed by QRS, this is not the case. So
Yes.
it is not type 1. It is not first degree. It is not second degree. It is what? Third degree. And what the key I told you? QRS are wide.
Yeah.
You got it?
Yes.
Very good. And we have here another example. And as you see, Mark, we have what? Can you go by yourself, Mark, to identify this strip?
Yeah, I can try.
Okay, try. Good job. I will help you. What this?
That's a spike.
What this?
Another spike
Very good. What this?
and another spike.
Okay, so what you think this pacemaker strip is
Double.
single channel or dual channel?
It's a dual channel.
Very good, perfect. This one is belong to atrial, and this one belong to ventricle. What is after atrial? We have small P wave. You see P wave? What
Yes.
after the ventricle? We get the QRS, which is wide QRS. Is it clear?
Yeah.
Very good. Let us practice something else. Who is smart? I know all of you are smart, but some of you are very shy. So, Diana, can you share with us? Diana, are you online? This means you are not online, so you are absent. Siti, are you online?
Yes, I'm online.
Okay, can you go? Can I ask you about this strip?
Yes, I can try.
Okay, good. If I ask you, CD, what do you think about this?
It's P, QRS, and T.
Very good.
And then and the second one is a spike.
Okay, let us talk about this one first. What do you think this one looks like any other ones here?
No.
No, you are wrong. It is the same
Oh,
like
there's
this.
Yeah, the second one.
It is similar to
Yes,
this.
2P, 1 QRS.
Similar to this, right?
Yes.
So this three circle which we did represent what? If you answer, I will like very proud of you. What these three circles which I did represent what?
Contraction.
2P,
Yeah,
2
wonderful. I
PRS,
know it
1
is contraction.
QRS.
Which contraction?
Ventricle?
So P represent ventricle.
No, atrial.
Okay. So atrial and ventricle,
Ventricle.
right?
Yes.
Okay. Go by the 5 steps regarding these 3 circles. You consider P is normal?
Yes.
Very good. You consider QRS normal?
Yes.
Very good. You consider PR interval normal?
Yes.
Very good. So this yes and this yes and this yes will put what is the word? Normal, normal, normal means what?
Sinus.
Very good, very good. This is what I need. So these 3 beats represent sinus activity. You agree?
Yes.
Very good. Now I have, you mentioned this is spike, right?
Yes.
Okay. Let us highlight it. So this is spike, correct. And after the spike, what we have here?
It's a P.
No, after the spike is what? This one.
The QR.
Yes, QRS. Very good. Here we have spike.
Yes, a spike.
What followed the spike?
QRS.
Very good. We have spike here.
Yes,
So after the spike, we get what?
another QRS.
Very good. We have here spike and followed by
A
QRS.
QRS.
Okay. You agree?
Yes.
So this spike followed by QRS. So this means the wire is where?
Mm,
In the ventricle.
Very good.
No.
Correct
Sorry.
answer. No, correct answer. Correct answer. So far I have a spike followed by wave. I have to look to the wave. This wave coming from where? Coming from the atrium. So that's the wire in the atrium. Coming from the ventricle. So it is coming, or the wire is in the ventricle. So here, CD, we have spike followed by QRS. Correct? So the wire is where? And say it.
the ventricle.
Which ventricle?
Is it the right ventricle?
Right
Correct
ventricle.
answer. Correct answer. Correct answer. Right ventricle. We don't have any issue with the left side of the heart. All in the right side of the heart. And you see, guys, and you recognize that the QRS here is normal or abnormal. Aaron, share with me.
The
This
QRSs with the red circles, right?
say it again,
The QRSs with the red circles.
is what?
Are you talking about
Vertical. Yes, I know. But I am asking about this red circle
Yeah,
QRS.
the second
are-
QRS is wide and bizarre.
Very good. So this means what? The ventricle is healthy?
No, it is not healthy.
Very good. Very good. So by this discussion, you are capable to go through any slides talking about EKG, heart block, or pacemaker. And I hope you learned something very interesting. And we have, like God willing, on Monday, we will have our second test, or let us vote. I can open the second test to be on tomorrow, and we take the final by Wednesday. So what you prefer, to make the second test on Monday or tomorrow?
Monday.
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 Monday, okay, I agree. So
I need
the
a lot of
second-
studying.
Okay, I respect you. So our test will be, second test will be on Monday, 9 a.m. And the final will be Wednesday, 9 a.m. also. And we will have lab on Tuesday as usual, 9:30. Till we meet, of course, I had a request from Zara. So Zara, please stay online. You are going to, and I already opened the test, but I think it will be closed now because I let it open till 1:30. Did you have a chance to look at your test?
No, I didn't realize it was open. I'm sorry.
Okay, so I will reopen it again for you, not to take the test, but to see your answers, how your answers is going on. But I can't share this to everyone. So sorry, she has only this request. If you need also the same request, we can schedule for everyone at a time. Okay, you can leave now and enjoy the rest of the day.
Thank you.
Thank you.
You're welcome.
Thank you. Have a nice weekend.
You too.